Let's talk about some tips and tricks to make splint application with Orthoglass a little bit easier for you and more comfortable for your patient. So when I use the word Orthoglass, that's a name brand, but whatever brand your hospital carries, this is the material that we use to make splints on our patients. And it usually comes in like a felt sleeve, which I always start by taking it out of the sleeve after I've measured the patient and I know exactly how long I need. So I take it out of this, and the problem with Orthoglass is what it's designed to do is as soon as it hits air and you activate it with water, it will start to harden. As a matter of fact, that's how I got this piece. I went to do a splint the other night at work and somebody had left it open and the last 6 inches hanging out the package had cured. So listen, that's really hard. And see this edge? That is like a sawtooth blade, and that will be really uncomfortable on your patient if that's at the edge of their splint and rubbing on their arm. So here's what I always do. Take it out of that felt covering. Now, when you're cutting Orthoglass, I think everybody knows this, but do not use your good scissors. I would never ruin my Trauma X shears by using them on Orthoglass because it will gum up the blade. So I always trim about an inch. Oh my gosh, it's really hard to do once it's cured. Okay, it's much easier before it's cured. Now, why do I trim that inch off? Because I want there to be a little bit of extra room here in that casing when I put it back on there. Now we've got a little margin of error, a little buffer zone to where you're gonna have this felt edge protecting it and not having this against your patient's arm. We already took it out of the felt casing and trimmed it down. Now we just get a little bit of water. Zoop, that's plenty. And then I immediately get all of that out of there. All right, we got this wet, but let me tell you what I've seen other people do before. I have seen some people leave it inside the felt casing and get this entire thing wet and not wring it out. And so yes, that Orthoglass is still going to cure inside of there, but now this splint is going to stink to high heaven in no time flat on your patient because everything was wet and it's going to be mildewy and gross, kind of like a towel that you left on the bathroom floor after taking a bath. Now, if you do it right, we're going to take it out of the felt, get it a little bit wet, dry the whole thing off, put it back in. Now, as we are putting it on our patient, first of all, make sure that you are applying the correct splint that your physician has ordered. I can never remember what splint is called what, so that's why I put it in my ER nurse's clinical field guide. This part right here, I wrote for me because I can never remember what splint is what. So you know what splint you're applying. As you are shaping it around your patient's extremity, make sure that you are not handling it with your fingertips. Otherwise, you're going to create little dimples in the Orthoglass, and that's going to be a pressure spot that's going to rub on the patient and could possibly form a wound. So we want to make sure that we're handling it kind of like when you're feeding a horse. You don't go in with your fingers because they'll bite you. You hand them a treat with a flat hand like this. We're going to do the same thing with our Orthoglass. We're going to hold it onto our patient while it is curing. And then of course, we always want to do our follow-up education and our set assessments to make sure the distal extremity still has a good pulse, cap refill, sensation, and movement. So there's a few tips and tricks for how to appropriately apply an Orthoglass. And a testament to why we trim the edge off so it doesn't poke your patient, I definitely got a little Orthoglass splinter when I was trying to cut this.